I think that it takes a lot to build trust, but it takes very little to shake that trust. And I also think that, the way to build trust, differs greatly between developed world and developing economies, as you said. For instance, in a country of the size and scale of India, where awareness is low, education is low, 70% of your population is living in villages, where exposure to media is highly limited, I think who builds trust is a critical question. I think I agree that actually it is the frontline workers who really have to carry the onus of communication, because it is up to them to give credible, objective, effective information. However, having said that, I think you really need to go beyond frontline workers and actually create communicators, at the community level. And in India, what we have seen is that in every village now, we have created a village health and sanitation committee. Actually, where you have a lot of people from the village community represented. And those are the people who are, organizing village health and nutrition days, where they generate demand for immunization. So I think be it frontline workers or non-governmental actors, actually I think the end objective really has to be community mobilization, and community has to finally sort of have insights into their own issues.
It's really, really important to think about what is the message and who is delivering the message. And that may vary depending on the local market and where the consumer or the mother is. And I think having empathy around that and fully appreciating what's the approach, and it's not a one-size-fits-all approach, is critically important. I think that industry, in some cases, it's appropriate for us to take a back seat. I think it's knowing when to speak and how to speak. I do believe that whenever there's controversy or there's an issue of reputation or concern, people are looking at the voice and who do they believe. And so in many cases, it may be best for industry to work with other constituencies, but it may be best to have a physician out talking about the issue, or a pediatrician. And I think sometimes industry, and I feel it, we have terrific scientists, and I know many of our partners in industry are very proud of the work we do, so we want to go out and talk about all this wonderful work. There always is skepticism, and so I think understanding that and figuring out to me, at the end of the day, the right communication is more important than whether I deliver it as industry. So if I can figure out that mothers to mothers is the better way to do that, that's great.
The third aspect is how we communicate on vaccines. I don't think we're good at it. I don't think we're good in general in terms of communicating about science. There are many speakers about what scientists do and the outcomes of the research, but in vaccines or vaccination, how best do you do that? I think a lot of times we make it up, and that obviously would have to change. The more vaccines you have out there, the more people that need to be reached with specific vaccines, so that we, let's say, have a much more improved way of communicating the benefit, because no father or mother would actually understand the benefit of a vaccine truly and say that I don't want my child to get this vaccine. It's more lack of understanding or something that is blocking that understanding. Recently in Nigeria, we looked at where people are getting their information. For a large part, it's television, newspapers. We assumed that these are where people get their information, but that's not where they get their information. It's the radio, it's peer communication, it's using institutions that are local, the priests. When they say something, people actually take it and tell it to the neighbors. The traditional leader, when he speaks about an issue, others listen to it and they take it to somebody else. Those social networks and tapping into them to send the message, I think, is more effective than sort of a media-based approach to selling immunization.
In 2009, we had quite a few cases of swine flu in the country. And again, the issue was not whether people would believe whether the vaccine would work or not, but the issue was, everyone asked in the media, would there be even enough vaccines and would it reach South Africa in time? And an interesting thing that happened was that there were only 2 or 3 government people who could speak on the issue, and they just didn't have enough time to speak to the media. There were too many queries and too many requests to speak to them. And that opened up space for people who were sort of second-tier scientists or not the right people to speak on vaccines to actually give their opinion in the media. But I do think it's extremely difficult for journalists, especially in developing countries where it's not a person with a science degree that reports on science, to assess whether it's the right scientist or not. And I think, like it's just been pointed out, that there should be some sort of help. If there then isn't the ability to assess exactly whether it's the right person or not, then the right scientists need to be put forward by someone.
One thing about the toolkits and about how to build reservoirs of trust, we have an example now in several countries of a thing called a science media centre. What the Science Media Centre does, and there's one in London, there's one in New Zealand, there's one in other countries now, is to bring journalists together for long-range briefings about topics. What's coming down the line? What are the things that we do know about this particular technology? As well as providing rapid responses when a story breaks. And I think that sort of culturing of an understanding amongst the journalistic community is one key step. Doing the same with the networks of bloggers, for example. There are some very prominent people now who blog, and doing so with these other networks, the equivalent. Actually taking that sort of investment of time and effort to get people primed in areas which could turn hot any moment, I think is an example to follow.